everyone. I'm Dr. Shahin Isaac Bina. I practice in Encino. My main focus is full mouth reconstructions and implant dentistry. My passion is to build a bone patients have lost, try to restore what they had as close as possible to the natural teeth and the ones that they have. Welcome to our informative program. We created this program for all the people that are missing teeth and are trying to get their teeth fixed by the process that is called All-on-4. We want to give some information about the pros and cons of the service that is widely used, and you can judge to see if this is something that you can benefit from, and also to give you some information about the alternative of this treatment. Many people are suffering from tooth loss, and that's a big, huge problem for a lot of people, and they are not aware of it because most of the time it doesn't cause pain or discomfort. But millions of people are suffering from not having teeth. That can affect a lot of their function, eating food, and also associated the problems such as shifting their teeth, the misaligned teeth, their jawbone deteriorating and causing bone loss, and subsequently shrinkage of the tissues supporting the bone. Implants have been used for decades to solve this problem, maintain the bone structure, bite. Now, one of the common methods that's being used right now is called All-on-4. That's a name that has been going around. Many people have heard about it. They seek that treatment. It has been for about a little bit over 2 decades that has been used and then has been modified over time. There are 4 implants that strategically placed into your jawbone, and it helps to hold a prosthesis, a fixed prosthesis, or can be made from different materials. Okay, for our All-on-4, All-on-6 cases, we have many different options available in terms of the material used. We can use what is called a PMMA. It is colored. This is usually what the patients get and live with it. It's a temporary material while the implants are taking but the patients get an idea if they want to change anything about teeth. Then this is one choice. One of the most common one being advertised is zirconia. Zirconia would be this material that is a little bit heavy but very durable. These usually last a very long time. There are like material that are very aesthetic. People who really want natural looking teeth, so this is the material we recommend. There are other options. This is again 4 implants that it goes in, but this is top of the line because the framework is designed like teeth. As you can see over here, these are like teeth. Then the individual crowns goes cemented on these individual ones. Then you make the framework like this. We have unrestricted choice of material and crowns, and these are much more aesthetic, durable, and it is like really one of the best. One of the appealing characteristics for All-on-4 is that people can walk out having teeth, but I just want to clarify that because there are a lot of other advertising that make you believe it's going to be a permanent teeth. That's not the case. You get the 4 implants placed in, and you would have a temporary prosthesis placed that you can still function with it, and it's going to help you to determine if this is something you would like to have in future. You still have to wait for the healing time to be finished. That usually varies from 4 to 6 months before you get the final treatment. But it is one of those appealing procedures for people that they want to get their teeth done in one visit and walk out having teeth in the mouth. Who should consider getting an all-on-4 or the treatment? People who already have dentures, they have lost their teeth, they are usually very good candidates, usually. And especially if you have been wearing denture for a long time, your bone availability might be limited. Many people already have the periodontal disease, a lot of teeth that are not salvageable, that need to be extracted. All-on-4 would be a very good treatment plan for those people. And for many people that they have noticed their jaws getting smaller, their skins are getting wrinkles, and they have inability to chew food properly, to use their dentures or teeth to eat properly. And also another good way for many people to seek All-on-4 is the financial considerations. All-on-4 is an introductory level, in my opinion. It's an early stage, early step for majority of people that's going to solve their problem. And who should not consider All-on-4? People who already have some good teeth that they want to save and only want to place implants on where there are missing teeth. That's one start. It's always good to save your teeth as much as possible, as long as possible, if they are good, healthy, and they can serve you for a long time. If you are missing teeth in one side of your mouth, the other side are good, just focus on that side. All-on-4 as being one of the treatment options for many people is very good, but I want everybody knows that that's not the only option you have. There are different designs. You can have All-on-5, All-on-6. By adding more implants, you add more longevity and security for the prosthesis, and you have more treatment options available in terms of restorations later on. These are some options. There are other options if you want to place more implants, and what I call it segmented bridges, and that involves breaking that bridge into 3 or 4 pieces. By adding more implants, you can do that, and I like to do that treatment a lot because it lasts a long time and it solves a lot of cosmetic and function issues for majority of people. Most of my patients are very happy. We are here with one of our best patients ever, Bart, that we did multiple implants for him on top and on the bottom. He's the one actually went to how many offices? Tell them. Doctors. 6 different doctors. And we were the last one that he came. And what is it that they wanted to do for you?
They all were advertising just only give me a 4-on-1, and they wanted to cut my jawbone. I think that's to get rid of what they might call bad bone, but it kind of plateaus your jaw to fit their teeth that they have. It's something that they're going to do to you to make their their product fit. And I didn't like the idea. I was convinced after coming here that I had good bone and there was something better we could do.
For Bart, I built the bone. We did 8 for him on top and 8 on the bottom. We can do traditional bridges that goes on the implant. Easy access for cleaning, much better to maintain, much cheaper to maintain because you can just get a regular cleaning. Whereas the All-on-4, the doctor has to take everything apart, take it out, and then do the cleaning, and that's gonna be very costly. Segmented bridges requires 8 or 10 implants, and this way you can put like one segment here, one bridge, one in the front, one over here. One of the advantages is that it's going to last a very, very, very long time. That is very secured, and the force distribution of all those implants is the best because it's the closest to your natural teeth. And the other advantage is aesthetics. The aesthetics is far superior and much better than the other All-on X prostheses are available. They can look also very good depending on the choice of material, but they have more alternatives available when you do segmented bridges. And then I personally prefer to put 5 or 6 implants more, and the reason is that the more implants you place in is more secure. You buy more security and insurance. In the All-on-4 scenario, if you have one implant that fails, the whole system fails. The whole process is going to fail, and then you have to redo everything all over again because you cannot retrofit the original one. When you do additional implants, either 5 or preferably 6 if it's possible. If one implant fails, you still can use the same prosthesis, and it's very easy for the dentist to remove the prosthesis that you have in your mouth, remove the failed implant, and then just the other 5 can carry on and hold the prosthesis. So it will save you thousands and thousands and thousands of dollars. The other reason is that it maintains the bone better when you have more implants. The bone needs to be stimulated either from tooth or implant. That's why it starts to shrink when you are missing your teeth. But once you place the implant, it secures its vitality and the bone stays in. Another advantage is that your bite forces will be more balanced. You can exert more pressure. It is much better when you have more implants because the distribution of the forces, the bite forces, would be much better, less pressure on each individual implant. And that is going to translate to longevity and long-term success of the prosthesis, and the implants are going to have less hassle, less problems down the road. The most important factor for me is that in the process of All-on-4, All-on-X, the process requires removal of bone. In order to get to a platform to place those 4 implants, there is about half an inch of bone on top, half an inch of bone on the bottom that needs to be sectioned off and be removed. And this is one of the issues that I have problem with because I always want to build the bone. I have a constructive mentality instead of like destructive and removing of the bone. I think we should preserve as much as bone as possible. If, let's say, for any reason, you get an All-on-4 prosthesis and implants fail, and then you have to do the whole process again after like 7, 8, 10 years, whatever it takes that it has been in service, you don't have any bones to go to because you chopped up and removed all those bones from the beginning. So you're left with nothing. Now, please don't take losing teeth lightly. When teeth are extracted, it comes with consequences. One of the main things is that the bones start to collapse because there's nothing in there. And it doesn't happen right away, but eventually you're going to lose bone. It is very important to preserve that bone, especially if you are intending to place an implant in future. One of the current technique that we use is called bone grafting. When a tooth comes out, you want to restore that area by filling some bone material constituents that helps your body to build the bone in that area and maintain the bone for future implant placement. I hope some of the information that we covered is going to be beneficial to you, and I just want to sum everything up. I think the best thing for anyone who wants to fix their dental issues is to get a second, third opinion and then see what is good for you. It would be good to have a detailed, comprehensive evaluation and then seek your option and then see what is better for you. I wish you the best luck, and our office in Encino is available to provide you with that consultation. If you are seeking that treatment, we'll be more than happy to have you here for evaluation.